Hi, this is Jackie with Panama Relocation Tours. Thank you for joining us for a special live stream today. Today I'm going to be talking about solutions for healthcare and health insurance for people that have pre-existing conditions, and even for people that don't have pre-existing conditions. It's going to be just a super affordable way for you to get healthcare and health insurance in Panama. For those of you that are new, thank you so much for being here on our channel. And I see a lot of familiar names over in our chat. Thanks for everybody that's returning. I'm Jackie Lang, the owner of Panama Relocation Tours. Since 2010, we've been helping people move to Panama the right way. We have all-inclusive 6-day, 7-night relocation tours, private tours, and also something called our online guide. You can get more information about all of those things on our website at PanamaRelocationTours.com. Can everybody hear me okay? Yes, I think you can. Everybody can hear me okay. So I have a lot of information to cover today and even some slideshows to show you. So I just want to jump right into the information. So one of the biggest challenges of people coming to Panama is if they have pre-existing conditions. And then that means that you're not going to be able to get Panama health insurance, most likely. We do have an article on our website about your health insurance options in Panama, and there's some great health insurance options that are super affordable. But with most of those insurance options, they're going to exclude any pre-existing conditions. And if you have too many pre-existing conditions, or if you're diabetic, or if you've had cancer, they're just going to say, we won't write a new insurance policy for you. So that's a problem. That's a big problem for people that are wanting to move to Panama, especially if you have pre-existing conditions that you can't get insurance. Now, perhaps the insurance in the country you're in now might have some overseas coverage. So if you keep the insurance you have now, then you might have overseas coverage. But one of the reasons people are moving to Panama is to get rid of that great big premium that you're paying for the insurance that you have now, and to have more affordable health care and more affordable health insurance. So today I'm going to share with you what some of the options are for you, and I think you're going to be really pleased with the prices and the availability of that. So first and foremost, if you have pre-existing conditions or if you can't get health insurance in Panama, just know that you can use, even before you get your visa, you can use the public healthcare system in Panama. There are clinics and hospitals throughout the country. You could do a Google search for public hospitals in Panama, and you'll see there's many of them everywhere, and you can go there. They have specialists, cardiologists, urologists, all those things. You can go to the emergency room. You can schedule an appointment with just a doctor. The typical cost of one of those visits is going to be $2 to see a doctor. If you're seeing a specialist, it's $5 to see a specialist. Now, some of the doctors speak really good English and some of them don't. So you might want to take a translator with you or get real familiar with using Google Translate. And you could even, if you're making an appointment, you can say, please, I'd like a doctor that speaks English, and you may be able to get one. So just know that the public healthcare system is available to you all the time. But especially for those of you that are moving to Panama City, I want to share with you another option, and it's called, let me pop it up here on the screen. It's called MiniMed. MiniMed has 14 locations throughout Panama, and they're getting ready to add several more on the western side of the country. It's the largest private health network in Panama. They serve about 45,000 users every single month. They do about 27,000 laboratory tests every single month. They have 500 general consultations daily at all of the different clinics that they have. They also have about 150 specialist appointments. And you can join this. You can join this private network let me get to the screen. So they have it where you go to, like, you might see a consultation, and they might evaluate you and say, well, you need to see a specialist. And then if that's necessary, then they even have a hospital that you can go to if you need some more advanced care. So let me talk about, I'm going to put this screen up, by the way. It's going to be in the show notes that you can see. It has a list of all their different locations and what's available there. Some of the locations are 24 hours. Some are not 24-hour locations. But this is the important part that I want to share with you right here. So complete family health membership for expats. So this is what it's going to cost you. It's $20 a month to join, or you can pay annually $220 a year to join the MiniMed health membership for expats. If you're married, it's just $10 more for your spouse, or another $110 a year for your spouse. And I don't know if you can read the screen very well, but I have a printout here, so I'm going to read some of the things. So for general medicine, just to see a doctor, with your membership, you get unlimited visits to see doctors, no additional charge. If you need to see a specialist, your membership includes 2 appointments to see a specialist per year. If you need to see more than just twice a year, then you're going to be able to pay. You get a big discount on seeing the other ones, like a 10% discount. And it's only $50, so you're going to get a big discount. As far as the laboratory work, they do about 50 different laboratory tests are included, no additional fee for laboratory work. So if you need to have your glucose checked, or you need your lipid panel done, or things like that, it's all included in your membership. Also included in your membership is imaging, or things like x-rays. There's more than 100 type of x-rays that are included in your membership with no additional charge. Imagine paying $20 a month for your health insurance, or this health membership, they call it, and you get all of these things are included. There's not an additional copay. Also included in that is they'll do 1 ambulance transfer. So if you have a medical emergency, you can call them and they'll send the ambulance to get you, and they have their own hospital. In addition to the 14 clinics, they have their own hospital. Or if you're just really feeling really crummy, and I know we've all had days like that. I had bronchitis a few months ago. I didn't even want to get out of bed. If you're feeling really bad, you get 1 home health care is included in that. Yeah, you get 3 home health cares per year is included in your membership. And if you need extra, it's only $25 to have home health care come to your house. Now, I read all of this stuff and I thought, this all sounds too good to be true. So I've talked to the owner of MiniMed. I've talked to the director of MiniMed. And, we had a video conference call and I talked to them, but I also wanted to get it in writing. So Felipe, who's one of the directors there, I sent him an email, a WhatsApp message. I said, under coverage, it seems to indicate unlimited coverage for consultations, laboratory, and x-rays with no extra fee. And he said, I'm reading on my cell phone, he said, that's correct. Although it may seem suspicious or too good to be true, it is indeed the case. General medicine consultations are unlimited, as well as laboratory tests and imaging. The only limitation is a preferred list, not the number of uses. The covered lab tests are those priced under $50, and there's about 50 different tests. And the covered imaging studies are those that are under $100, and there's about 100 different studies that they can do with imaging. Anything not included in the list receives a 15% discount. So this is going to be a game changer for you guys. For $20 a month, you can join this, and you can drop out anytime you want to, or you may want to go ahead and pay for a whole year in advance. $220 a year for the first person. If you're married, it's another $110 a year for your spouse. Don't forget, I'm going to be sharing this whole slide with you after the show. So some other things, it's the same thing that it says right there. This is also going to be on the online guide. I have the number for Felipe Ramirez, who's the director. His WhatsApp number is right there. So if you have some more questions about it, then you can do it. The other thing that's really important for you to know, let me add another screen on here. Hold on. I'm new to this sharing screen things. The other thing that's really important to know is that at MiniMed and their 14 locations and their hospital, veterans can see any of the doctors, any of the specialists, and they do direct billing for veterans for TRICARE, FMP, CHAMP VA. All those things are included. Veteran focused care. I'm going to share this screen with you also. They want to take care of you, your medications. They'll bill the VA directly for all your health care and all of your medications. And it's going to be convenient because there's so many different clinics that you can go to. You don't have to wait a long time at a hospital. There's even a veterans helpline that you can call. There's someone bilingual that's there all the time. They'll help you get an appointment set up to see a specialist, or if you need some other things done for veterans, then that's going to be readily available to you also. So let's see. Let me figure out how to take it down. Remove from the screen. Okay. I'm new to this whole sharing things on the screen. So doesn't it sound perfect at that price? What do you think about paying $20 a month to have a health membership where you get unlimited doctor visits, unlimited laboratory, unlimited x-rays, and if necessary, they'll come to your house 3 times a year for home care. But if you use more than 3, it's only $25 extra for you to be able to do it. Right now, it's available in many, many locations in Panama City. It's available in Colón and as far west as Costa Verde. They are opening up a new office in Boquete. They're going to have one in David, and they plan to have one in Chitre as well. So they'll have some other locations throughout the country as soon as possible. And then I'll have some other news about MiniMed really soon, but I just can't share that yet. So for those of you that have other questions about things that are putting up your 3 question marks, this is not a Q&A live stream. Next Saturday, we're going to do the Q&A live stream. This live stream is exclusively about healthcare and health insurance options. So one of the things about this health membership that's only $20 a month for one person, or be $30 a month for a couple, is that if you should have an emergency, if you go to the clinic and you have an emergency, they feel that you need to go to the hospital, they have their own hospital in Panama City. And your hospital visit, because you're a member, is going to be $200. Now, if you have to be admitted to the hospital, of course, it's going to be a little bit more, but you're going to be able to keep control of your cost. You don't have to worry about, oh my gosh, what if it's going to be $5,000 or $10,000? And at some of the private hospitals, you might be paying those kind of prices. Like if you went to Pacifica Salud, or you went to some of the other private hospitals. Let's say I know someone was in the hospital for 5 days because they had high blood pressure, and it was more than a $5,000 bill. But you don't have to worry about that at the MiniMed hospital. The most it would probably cost would be $500. So you're going to be able to keep your costs down very, very low. If you could please hold off on your questions. I see a lot of things with question marks. I've got several more things to share with you before I'm ready to take some questions. So like I said, I'm going to share this brochure with you in the show notes after the live stream. But I'm super excited about this. And everyone I've talked to there they're so helpful. They want to bend over backwards to help you, and they welcome you to come to their clinics all over the country. So you might be thinking about, well, what if I do have the big one? What if I have a stroke, or what if I have a heart attack, or what if I break my hip? What's that going to cost me? Well, that might cost more if you go to the hospital at MiniMed, the MiniMed hospital. What the exact cost would be, I don't know. It would depend on what needs to be done, what specialists are done, how long you're in the hospital, and all of those things. So one of the solutions to this unknown cost about healthcare, that's one of the scary things is, well, what's it going to cost? Is if you're a U.S. citizen and you have Medicare Advantage, your Medicare Advantage will cover any urgent cares or emergencies that you have in Panama. So if you're a U.S. citizen, I encourage you to don't get rid of your Medicare whenever you move to Panama. And I'll have a solution for those of you that don't have Medicare in just a little bit. So hang on with me. I've got some more solutions coming. So if you have Medicare Advantage and you have a heart attack or a stroke or you break your hip or car accident or whatever it might be, and you're going to the emergency room, then it's going to be Medicare Advantage would cover that. And we have several different hospitals where it's all direct pay. You just show your Medicare Advantage card and you don't have to prepay and then file a claim. The other thing at the MiniMed is it does include it's going to include an ambulance service also is included. So if you go to one of the clinics and they determine you need to go to the hospital, it includes your ambulance service for no extra fee. So what's the solution for those of you that you're not old enough, you're not a U.S. citizen, or you're not old enough to get Medicare Advantage yet? So what's the solution for that? For if you have a medical emergency like a stroke, a heart attack, break your hip. You know, some people have had to have, if you are not watching where you're walking in Panama, then you could fall down and break your arm or your wrist or your ankle. So what's going to be the solution for you? In our online Panama relocation guide, we have a list of several different travel insurance companies that will do travel insurance by the year. You can buy it for a whole year. I just did a search today. If I was 60 years old and I wanted to get 1 year of coverage for medical emergencies in Panama, my cost would be, let me get my notes, my cost would be $534 a year with one of the medical travel insurances that we work with. And you don't have to, you can be from any country and you can get that travel insurance. So even if you're up to age 75 with some of the travel insurances, you can get a 1 year policy. We have one travel insurance company that will insure you up to age 80. So and that includes $250,000 a year of coverage. Now you might be thinking, well, but some of those exclude pre-existing conditions. The ones that we have listed in our online guide, they have a rider that you can pay a little bit of extra money for that includes any pre-existing conditions. Now sometimes they have a wait time that includes pre-existing conditions after the first 30 days of having the service, and sometimes they don't. So let me put up this brochure. So our online Panama relocation guide, and if you just click on online guide on our website, we have a list of immigration attorneys, real estate agents, expat health insurance. I've updated it with new information about everything I'm sharing today, pet relocation, and also travel insurance that you can get by the year. So if you can't get insurance in Panama, there are solutions for you. There's the MiniMed, that's one solution. Medicare Advantage is another solution. And also the travel insurance that you can get a 1 year policy, or maybe you're only going to be in Panama for 6 months. You can get a 6-month policy. So both of those are going to be really good solutions for you. And then one of the other things I said I was going to talk about in the advertisement about this is for veterans. You know, where's the best place to go for veterans so that you don't have to prepay and then file a claim? Where can you go where you can just, you know, if you're foreign FMP, the foreign medical program is only for service-connected disabilities, if you qualify for that. And we do have an article on our website about the foreign medical program to find out if you qualify, or TRICARE or CHAMP VA, or any of those things. One of the best places to go is, of course, the MiniMed locations, because they do direct billing. They'll also bill for any medications that you need and things like that. Some other places you can go in Panama City, you can go to the San Fernando Hospital. They also have a location in Coronado. They have a little clinic in Coronado. And then in David, you can go to Hospital May Louis or Hospital Cherokee. So all of those, and also Hospital Nacional in Panama City is another good place for veterans to go, where you can just show your card and you don't have to prepay anything, unless I know with TRICARE, I think you have to pay $150 a year or something like that, but they'll check into it so that they know what your prepay is going to be. So that's an overview of all of the things that I've been trying to a solution that I've been trying to find for you. And I think MiniMed is absolutely the best, especially now that they're expanding to other locations outside of Panama City. It's going to be the perfect solution for you. You might even want to live in Panama City until they get set up in one of the other locations that you're planning to move to. But remember, you can always use the public hospitals also. They don't care how old you are at the public hospitals. They don't care if you have pre-existing conditions. You can always use the public hospitals. So you have several different super affordable locations. So now I see some questions that are coming up. And let me get over here and click on some of the questions. If you have a question for me that's about these health insurance and healthcare options, then you can type it into the chat window and put 3 question marks in front of it. If your question's about getting a visa or getting your dog here or any of those other things, you're gonna have to hold off until next Saturday when I do a Q&A live stream next Saturday. So Margarita says, great job. Jackie, what's the best health advantage company to get for a pre-existing condition Medicare insurance? So the best Medicare Advantage insurance for you to get is the one that you qualify for. Remember that to get Medicare Advantage, you have to have a U.S. address, and your Medicare Advantage is kind of assigned by the zip code for that address. So we have 2 recommendations in our online Panama relocation guide of people that have been in business more than 25 years each, that are Medicare Advantage experts, and they can pick out the one that's best for you. I can tell you that many of the Medicare Advantage plans, like I have United Healthcare, Medicare Advantage, some of them offer a give back. So the regular price of Medicare Advantage is like $185 a month, which is a chunk of change. But, if you get one that gives $100 give back, then you're only paying $85 a month for this emergency medical insurance that you'll have in Panama. Plus, you can use that when you're back in the United States. If you take a lot of medications also, you can work with your doctor in the U.S. and you can get they can send a prescription to Amazon Pharmacy. Then your medications can be sent to Panama for about $3 per prescription instead of you buying them in Panama. So if you can get Medicare Advantage, if you qualify for it, I highly recommend that you get it. Which plan is best for you depends on you. Do you take medications or not? Where do you live? Which plans are available? Do you only want to get a plan that's going to give you a give back so that you don't have to pay $185, maybe only pay $100 a month for that insurance? And our Medicare Advantage agents can help you with that. So, next question, any company that will cover pre-existing conditions like cancer in the past. So yes, the MiniMed, they're going to cover those they have no exclusions for pre-existing conditions. So at the MiniMed, one of the things that says in their brochure is no pre-existing condition limitations, none. No age restrictions, none. And there can be up to 4 people in your family that are under one family plan. You can do a monthly plan or an annual plan, whichever one fits your budget the best. So if you've had cancer in the past and you need to keep on going to see a doctor because of your cancer or you're diabetic or whatever your pre-existing condition is, MiniMed is your best choice. David says, do I understand that the MiniMed memberships doesn't exclude coverage? Yeah, there's no exclusions for pre-existing conditions with MiniMed. It says it right on their literature, no exclusions for pre-existing conditions. That's the beauty of it all. I'm going to be sharing this in the show notes after this live stream so you can read through it yourself. And also a link to their website so you can check it out. Next question. Kenneth says, which hospitals in Panama City are doing direct billing for Medicare Advantage at this time? Well, Kenneth, currently there are no hospitals in Panama City. I was hoping I was going to be able to announce 2 hospitals in Panama City, but there's been some little problems with the contracts. We're working on getting the contracts finalized, and once those are finalized, hopefully by next week, then I'll be able to announce which hospitals in Panama City accept Medicare Advantage. Is there an inexpensive worldwide medical health insurance for urgent care and emergencies only? Yes, there is. And I used to have that, before I got Medicare Advantage. And we have a insurance agent that's in the online Panama relocation guide, and I have a brochure. So regular worldwide medical that's going to cover all kinds of different things is quite expensive. Like if you're 65, you'd be looking at $3,500, $4,000 a year to get that. But you can get one that only covers urgent care and emergencies and cancer that's like $2,000, $2,500 a year. So it's super affordable. And we have details about that in our online Panama relocation guide, along with who you should contact. I have Medicare and a United Healthcare supplement. I called them and I was told I would not be covered for claims in Panama. So first of all, you're not. If you have a supplement plan, if you have a Medicare supplement plan, it only covers the first 60 days outside of the United States for an emergency or urgent care. The other thing is there's a 20% copay. So if you needed to have a $50,000 emergency heart surgery, you'd have to pay 20% of that. And with the supplements overseas, it only covers $50,000 lifetime limit. So a supplement's not going to do you any good overseas. You have to switch to an Advantage plan to be able to get much better coverage. And like I said, we have 2 recommendations in our online Panama relocation guide right here. Just click on online guide on our website, and they can give you more information about which plan is best for you. So John wants to know, just for getting lab work, which facility would you recommend in Panama City? I'd recommend going to, you can go to any laboratory and you can order your own lab work. You don't need a doctor's prescription and you can pay for it. For example, I lived in Boquete, and I would go at least twice a year to a laboratory, and I would get, the full panel and a bunch of extra things, also check my vitamin D levels and other things. And it was only $42 to get that twice a year. But if you're a member of MiniMed for $20 a month or $220 a year, your lab work is all included in your membership. Do you have to go to MiniMed Hospital, or can you go to a public hospital? So with MiniMed, you have to go to one of their 14 clinics. They have 14 clinics or their hospital. If you want to use MiniMed, if you want to become a member of MiniMed. If you don't want to do that and you just want to pay as you go, then you can go to any public hospital. There's no monthly fee at all for the public hospital. It's just $2 to see a doctor, usually $5 for a specialist. I know someone that they cut their hand really bad, and they went to the public hospital in Volcan, and it was 50 cents for them to get it stitched up. So, worst case, it might be $2 if you go to the public hospital. How long has MiniMed been operating in Panama? I've never heard of it. I don't know the answer to that question. For them to have so many different locations, it must have been around for a long time. I've heard of them before, but I've just heard more and more people that are in Panama City that are using them. Instead of getting insurance, they were becoming a member of MiniMed, but I don't know the answer to when they started. Can you clarify Medicare Advantage in the States are generally free, Part B? So no, Medicare Part A is what's free. Medicare Part B, you usually have to pay $185 a month for it, and it comes right out of your Social Security. However, there are some Medicare Advantage plans that offer a give back so that you might only pay $100 a month or $120 a month and reduce your cost. I'm not an expert on Medicare Advantage. You would need to talk to one of the people that we recommend in the online guide, because all they do is work with expats in Panama and Mexico and Costa Rica. That's all they do is work with expats, helping them get Medicare Advantage. So, will you be adding MediMed info in our guide? I've already done it. I've already put the MediMed info, and the brochures are already inside of the online guide. So if you have access to the online Panama relocation guide, it's already in there. Did you say MiniMed is available in Coronado? MiniMed is available in Costa Verde, which is a little bit east of Coronado, but they're getting ready to open up some other locations further west. How soon do you anticipate MiniMed opening David Boquete? Within a year or a few months? They told me that they plan to open up something hopefully this year. Hopefully is the key word, and this year, and then it's Panama also, but hopefully it'll be this year. Meanwhile, there's a new, in Boquete, there is a new public hospital that's supposed to open in June in Boquete, and then of course there's a very large public hospital in David that you can go to. So you're always going to have some options. So Russ says, if you have previous health conditions like diabetes, do they have medicines like, oh yeah, they have a lot of different medications. So the way to determine if your medications are available in Panama, on our website at PanamaRelocationTours.com, in the upper right-hand corner, type the word drugs, DRUGS, and it's going to take you to an article with a link that has, it has a brochure you can get with the 50 most common medications and what they cost in Panama and if they're available in Panama. But it also has a link to 2 pharmacies in Panama where you can put in the name of any medication and you can check the price and availability of it. So someone didn't put 2 question marks. I'm 50, so I don't get Medicare yet. I need something more than just emergency coverage. I won't be living near a MediMed clinic. So your solution is to have 2 things. I would suggest you get 2 things. I would suggest that you get a travel insurance that's going to cover the major emergencies like heart attack, stroke, hip replacement. You know, if you fell and broke your hip, broke your arm or something like that. The other thing, just know that you can go to the public hospitals. We just did a video recently. I don't know if you've seen it or not, but it's a couple that lives in Casamar, which is in San Carlos. Casamar is the name of the development. And the husband, his name is Frank. He needed to have hernia surgery. So he saw a doctor at a public hospital. They did the hernia surgery. He was in the hospital for 4 days. And his total bill for the hernia surgery, 4 days in the hospital and everything, was less than $200. So that's what I'm trying to tell you is whether you join MiniMed or not, if you're in other areas, there's going to be public hospitals that are really close and you just pay as you go. So you don't have to be afraid about these $5,000, $10,000, $40,000 hospital bills if you're going to a public hospital or you're a member of MiniMed. Is a CAT scan or MRI included in the imaging, or is that extra? So I don't know if a CAT scan and MRI are included. They said that the note that I had from him, let me look in this. Let me look at my WhatsApp again on what his message said. It said imaging studies for those under $100, and there's about 100 different studies that are less than $100. And if it's not included, then you get a 15% discount. So I had a CT scan at Hospital Cherokee a couple of years ago, and it was and I didn't use insurance. I just paid for it. And I think it was $120 for a CT scan. So everything costs a lot. It's a lot more affordable here in Panama. So Charlie says, the person who signed me up for Medicare Advantage told me the Medicare Advantage plan will be overhauled and completely different next year. I'm sure it won't be better. Actually, Medicare Advantage, they do overhaul all the plans, are redone every single year. That's why it's so important for you to, when they send you that email that says, we've updated your plan, you need to click on it and you need to read it and see what it says. Actually, mine with United Healthcare is much better than it was the year before. So every single year I've had mine, it's gotten better and better with United Healthcare. So Russ says, if you have previous health conditions like diabetes, we already did that question. Sorry about that. So what is an emergency? Who decides? An emergency is anything that you feel that you need to get to the emergency room as fast as possible. You decide when that is. If you've just got a sore throat and a stuffy nose and things like that, that's probably not an emergency. So you could just go to one of the clinics or go to one of the public hospitals. But if you are having an allergic reaction and you're having a hard time breathing, you're like, then you want to get to the emergency room. Or call an ambulance. Even better, call an ambulance to get to the emergency room. Remember, the ambulance service is included with MiniMed also. Any idea of how much will it cost for a pacemaker replacement at MiniMed? I have no idea what it would cost for a pacemaker replacement. And someone wants to know if medications are covered. So some medications are going to be covered and some you're going to have to pay for, and they have a 20% discount on medications. Yeah, I'm checking the WhatsApp. 20% discount on medications, and their medications are already substantially less than they would be if you went to a private pharmacy. Is there a list of which 50 labs are included in the MiniMed membership? I don't have that list. I can try to get that list from them, and then I can put it inside of our online Panama relocation guide, so everybody will have a list of the 50 labs. I'll also get a list of the 100 imaging or x-ray kind of things that are included. So I'll try to get that list and I'll put it in the online Panama relocation guide for you. Where can you check the availability and price of your prescription medications and supplements? So to check the price of your prescription medications and supplements, remember, for many medications in Panama, you don't need a prescription. So you can just buy it over the counter. So if you go to our website at PanamaRelocationTours.com, let me pop that up on the screen. PanamaRelocationTours.com. In the upper right-hand corner, there's a little search feature. And if you type in drugs, DRUGS, it'll take you to an article where there's a link to 2 pharmacies where you can type in the name of your medication. You might have to put in the generic name because they don't always have the regular. So and then you can check the price of your medications. So someone said, what's the cost of an ambulance? So ambulance is included with your MiniMed. Also, if you have Medicare Advantage, then your ambulance service is included with Medicare Advantage for no extra fee. And not just an ambulance, but also air ambulance. We had a situation a few months ago where someone was in Santiago and they needed to get to a hospital in David, and that's like a 4 or 5 hour drive to get from Santiago. But instead, we got an air ambulance to pick them up in Santiago, and in 45 minutes, they were in the emergency room in David. Air ambulance is included with your Medicare Advantage. No extra fee. So if you have a previous health conditions, I just keep coming back to that one. Am I correct that your pensionado discount would not be available with MiniMed? So, it's $20 a month for the membership, and I don't know if they're going to I don't know if they're going to discount the $20 a month. It's so cheap. It's $20 a month or $220 a year for unlimited doctor visits, unlimited lab work, unlimited imaging. With all that included, I don't think I would even ask for a discount. Yeah, that's one of the things about the pensionado discounts. A lot of people move to Panama because of the pensionado discounts, and you can save a lot of money, like especially with airfare. Within 2 years, I saved enough money on airfare that it literally paid for the cost of me to get a residency visa. So it was absolutely worth it. But you have to be selective. If you're going to go to some fonda where it's, 2 meals for $10, don't ask for the pensionado discount at places like that. Or, if you're going to go to if you're getting a prescription and it's $4 for the prescription, yes, you could get 20% off, but do you really need to get 20% off on a $4 medication? Maybe not. So you need to be selective because it's right off their bottom line, what people are going to be making. Do you need to be living full-time in Panama to join MiniMed? No, you don't. You can pay by the month. If you're going to be in Panama for 1 month, for a scouting trip, or 3 months or 2 months, you can just pay by the month. Or if you're going to be here 6 months, you can pay for 6 months, or you can pay by the year. It's entirely up to you. If I can't get Medicare Advantage, what would you suggest for the least expensive way to have urgent care and emergencies in the U.S. while living in Panama? So if you can't get Medicare Advantage, what I would suggest you do is get travel insurance. There's some travel insurance that is going to cover you in Panama for any urgent care or emergencies. You can even get travel insurance that would cover you in the United States. So in Panama or any place else that you're covering. And you can buy a 6-month policy. You can buy a 1-month policy. The prices are super affordable. And we have recommendations on all of those inside of our online Panama relocation guide, along with who you need to contact to get signed up. They do offer a big discount for Panama relocation tour clients, so that'll save you some money too. So, if you're hospitalized, then you definitely want to ask for your pensionado discounts. But if you're seeing a doctor and it's, $15, whenever I see my doctor in Boquete, I don't even ask for it. He's usually $20, but I get the discount, so it's $15 to see my doctor. But if you're hospitalized, then you definitely want to get it. So, in the U.S., I've been told never to do Medicare Advantage, more costly, more hassle. If you're not returned to the U.S., do you think the benefits are worth it for a well person? So there are a couple of naturopaths that are in Panama. I know a lot of people that have Medicare Advantage. I mean, hundreds and hundreds of people that have Medicare Advantage in Panama, and they do go back to the United States once a year and they see their doctor there when they're visiting friends or family, and they've had no problem at all with Medicare Advantage in Panama, in the U.S. or in Panama. Great news. Thanks, Jackie. With a MiniMed for vets, is there coverage for your spouse? Yes, there is. So let me look at this price to make sure I get it right. So for the veteran, it's going to be, so they do the veteran coverage, everything is covered with that. For your spouse, for your dependent, it's going to be $10 a month for your dependent, or $110 a year, which includes unlimited doctor visits, unlimited lab work, unlimited imaging, ambulance transfers, all those things. So yes, your dependent gets a really good deal also. But if you're a veteran, I would highly recommend that you check out the MiniMed location that's closest to you. I'm going to post this brochure after the live stream, and you can see where the different locations are. Yes, the colonoscopy, it's all covered under MiniMed. Also, PSA test, mammograms, all those things is covered under MiniMed. It's $20 a month, $220 a year, and all those things are covered. Are there any plans for MiniMed to open additional hospitals in other locations other than Panama City? I know they're going to have other clinics. I don't know about other hospitals. What they will probably do is they're going to open a clinic. If they have a good amount of business at the clinic, then they would consider opening a hospital. But I didn't ask that question specifically, so I don't know the answer. Will yearly preventative care be covered with no copay? Yes, your yearly preventative care is covered with no copay. It's included in your $20 a month or $220 a year. All the preventative care, lab work, and all those things is all included. Question mark, Medicare and Part A and B with United Healthcare. That's what I have. I have United Healthcare with Medicare Advantage. I need clarification. You mentioned Medicare Advantage. Is that the same as a Plan G for Medicare? I don't know if it's the same. If Plan G is the same, you would need to talk to a Medicare Advantage expert. And we have 2 of those that work exclusively with expats that are listed in our online Panama relocation guide. Just when you log in, search Medicare Advantage and it'll take you right to their information. Any hint of a list of good and reliable. So this whole live stream is about healthcare and health insurance. If you have questions about movers, please hold that off, or other things. Please hold off until next Saturday when I do a general Q&A. I want to keep this live stream focused on healthcare and health insurance in Panama. Do you know anyone has used MiniMed and what the reviews are? I do know. I asked in our private Panama Relocation Tour Facebook group, I asked people just the other day if they had any reviews, and several people posted a review. They said that they've had several times they've had a doctor that came to their house, and almost one person said that they needed to have emergency surgery on their hand, and they got a doctor from Pacifica Salud that came and did it, and they were super pleased with it. It was very, very affordable. So I haven't had anybody that's given a complaint about MiniMed. Would MiniMed work with the traveler's insurance to get fuller coverage? One would make up or something isn't covered. Yes, it would. So the traveler's insurance would cover things that would put you in the emergency room, emergency surgery, emergency hospital stay. If you had a super high blood pressure and they had to hospitalize you to stabilize that. So your traveler's insurance would cover that. And yes, they will work with all of those things. Does MiniMed cover ongoing treatment for something discovered during a routine checkup? Absolutely. That's what they want to do, is your routine care. It says in their literature, let me try to find it someplace, but it says in their literature that their number one objective is that you go to the doctor on a regular basis so they can do screenings and they can catch things before it becomes a chronic illness. So they want to have preventative care is very important. But if you do get some kind of a chronic illness, it's going to include all of your ongoing treatment. Remember, there's no exclusion for pre-existing conditions. Fred says, this is wonderful information. Thank you. You're so welcome, Fred. I'm so glad that I was able to find a solution. You know, of course, the public hospitals have always been a solution if you have pre-existing conditions and you can't get health insurance. But this, sometimes when you go to a public hospital, there's a lot of people there. But with these clinics, with so many of them, you're going to get seen a lot faster, and $20 a month to have unlimited doctor visits. How good is that? So one of the things I always say is that you can live better for less in Panama. This is one example. You really can live better for less in Panama. Panama Pacifico MiniMed Clinic was awesome. The doctors was proficient in English and very professional. Thanks for letting us know, John. So yeah, when you see the map on where all the locations are, they're just everywhere. MiniMed does cover home oxygen if you need it. Do expats get charged higher rates? No, expats don't get charged higher rates in the public hospital. This information made my day. I'm so glad. Once I discovered this, and then I've had 3 different calls with the owner and the director. They sent me a bunch of literature. Of course, the literature they sent me was all in Spanish, but don't worry, I got it translated into English for you, so that you'll have an English version of everything. And but yeah, this is a solution for you guys. MiniMed is the solution. And some of their MiniMed locations are open 24 hours a day, 7 days a week. Some of their MiniMed locations close at 9 p.m., but they do have some really good hours. If someone asked if it covers dialysis, I'm assuming it would, that they do offer dialysis there. I think I remember reading about dialysis. I don't know if there's an extra charge for that or not. I would have to find out. Will the MiniMed be accepted by both private and public hospitals? No, that's not the way it works. For MiniMed is only accepted at MiniMed. You can't go to any hospital and use your MiniMed membership. You can't go to public hospital and use your MiniMed membership. So the MiniMed membership is only for their 14 clinics in the hospital that they have currently. They'll be adding some other clinics and probably some other hospitals too, but it's only accepted at MiniMed, no place else. And remember, if you have a question, you have to put 3 question marks in front of her, or I won't know that it's a question. 1 second, I got to take a quick drink here. MiniMed does allow appointments, but it says you don't need an appointment. You don't have to have an appointment. You can just walk in, but you can make an appointment. For the specialist, if you need to see a specialist, you'll have to make an appointment. But if you want to make an appointment to see a doctor at a certain time, you can certainly do that also. If you just want to go in without an appointment, you'll get seen very quickly, is what they said. Usually the wait is going to be less than 15 minutes. Does MiniMed work with public hospitals? No. MiniMed doesn't work. MiniMed only works at MiniMed hospitals and MiniMed clinics. Do you have MiniMed hospitals in Volcan? The only MiniMed hospital currently is in Panama City. There is a public hospital in Volcan, but there's no MiniMed hospitals outside of Panama City. So somebody's asking about CPAP machines and all these other things. I don't know the answers to those questions about these devices that you might need. For $20 a month, is what the membership is. You can contact MiniMed. I'll have a phone number and a WhatsApp, an email of someone that you can contact to find out if it's included. The other thing is, if for CPAP machines and things like that, you can certainly buy those in Panama, but if you have Medicare Advantage, you could have those shipped to you and it would be included with your Medicare Advantage. Would you please explain the price again for using the MiniMed hospital? So the price for membership at MiniMed is $20 a month or $220 a year. You get a discount if you pay by the year for one person. If you're married, your spouse would pay $10 a month or $110 for annual membership. So that's what's included in the Mini membership. That includes the clinics and the hospital. I missed the drug list that might not need prescriptions. Almost all, the only drugs that are going to need a prescription in Panama is an antibiotic or a narcotic. Anything else, you're not going to need a prescription, usually. What about dental and vision? I think they do have something to do with dental, but I don't know about the vision. I can tell you that vision care is super affordable here in Panama. I got my eyes checked and some new glasses, and because I have to have glasses when I'm driving. So glasses, and I also got some prescription sunglasses. The visit for the ophthalmologist that I went to, new frames, new glasses, was $150 for everything. So it's super affordable. I know that MiniMed does have some dental coverage at some of the clinics, but not all of them. But I don't know about vision care. So Bonnie says, so if I'm understanding correctly, if we come to Panama on a scouting trip for 3 to 6 months before we apply for residency, we can subscribe to MiniMed. That's right. You can subscribe to MiniMed for $20 a month, or for however you want to pay it, and that you can subscribe to MiniMed, just so you'll have that. So I know that some of the clinics cover dental, but I would just have to look at the brochure. So next question here. Are the MiniMed doctors exclusively to MiniMed, or do they also work at other hospitals? I don't know the answer to that question. I do know that someone said that they had to have emergency hand surgery, and they brought in a doctor from Pacifica Salud that usually works there. So my guess is that doctors from other hospitals also work at MiniMed, but they may have some doctors that are exclusive for MiniMed, but I don't know the answer. So I don't want to give you the wrong answer. What's the best option for Canadians with kids coming down for 3 months? So as far as health insurance, your best option for Canadians with kids, there's several different travel insurances that would cover your entire family at a super affordable price that would cover any urgent care or emergencies. That's one thing you can do, is get the travel insurance. The other thing is you can just use the public hospitals. So because you just pay as you go, there's no monthly fee for a public hospital. Sam says, thank you for all the great info. Can you recommend for annual travel insurance is good for anyone, only US, right? No, our travel insurance is good for any country. So that's why I was saying, if you can't get Medicare Advantage, or if you're not old enough, or if you're not a U.S. citizen, we have several travel insurance companies that we work with that offer travel insurance by the year, or 6 months, or 1 month, that's for people from Canada or from any country. And it's super affordable. One of the prices I got was, just before this, I put in, assuming I was 60 years old, which I'm not, I'm older than that, emergency coverage, with a pre-existing rider, by the way. I don't have any pre-existing conditions, but I put in a test. I said, yes, I have pre-existing conditions. It was $534 for a 1-year policy with up to $250,000 in coverage. So that's pretty darn good, I would say. So I hope you guys are happy with this new information. Right after the live stream, I'm going to include the brochures that I published, that I showed. Also, if you haven't already done so, please check out the information about the online Panama relocation guide. It's going to have your immigration attorneys. It's going to have all the information about MiniMed, 3 different brochures, contact information. Everything is already in the online guide. It has international movers, pet relocation, other kinds of insurance that you can get. It has our recommendations for people to help you get Medicare Advantage. So that's all available in the online guide. And one more thing I would really like, since I did all of this for you, I'm asking you to do one thing for me. And if you haven't already done so, please subscribe to our YouTube channel. It helps us a lot whenever you subscribe, because then YouTube says, hey, people like this channel and they might recommend it to people. So it really helps a lot if you subscribe to our YouTube channel. So I hope you like this new information. I think it's a game changer for Panama, especially if you're living in the Panama City area or even the Coronado area, because Costa Verde isn't very far. And soon it's going to be in other locations throughout Panama as well. Of course, I'm going to keep on following up with them and saying, when are you going to open in Boquete? When are you going to open in David? When are you going to open in these other places, to try to light a fire underneath them to get it to happen a little bit sooner. So I hope you enjoy the rest of your weekend, and thank you so much for joining us for the Saturday live stream. Next Saturday is going to be our Q&A. I'm just going to answer your questions one right after the other, and that's your chance to ask about pets and movers and all those other kind of things. So thank you so much for joining us. Enjoy the rest of your weekend, and don't forget, please subscribe to our YouTube channel if you haven't already done so. Goodbye, everybody.